Hello, everyone. We'll just give it one more minute. We still have some people joining, and then we'll go ahead and get started. All right, I think I will go ahead and get started now. It's 12:03, so I can officially say welcome and good afternoon to each of you. Thank you so much for joining us today for our North Carolina COVID-19 Advocacy Update webinar. I'm Lauren Kidder, the Executive Director of the Carolinas chapter of Autism Speaks. Our chapter is located in Charlotte, North Carolina, and myself, along with my colleague Sarah Pittman, who's on this call today, oversee Autism Speaks mission delivery and fundraising efforts that take place in both of the Carolinas. A quick housekeeping announcement before we begin. I want to let everyone know that you will be automatically muted throughout this presentation. So should you have any questions, I would strongly encourage you to just type them in the chat box and we will monitor and address them throughout the presentation. To give you a brief overview of the Autism Speaks mission, Autism Speaks was founded in 2005, and this year we celebrated our 15th anniversary. But to summarize our mission, Autism Speaks is dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of individuals with autism and their families. And we do this work through our 5 mission objectives. So through partnerships and collaboration, we are committed to increasing global understanding and acceptance of people with autism, being a catalyst for life-enhancing research breakthroughs, increasing early childhood screening and timely interventions, improving the transition to adulthood, and ensuring access to reliable information and services throughout the lifespan. Thank you again for joining us today, and at this time, I'm going to turn it over to Judith Ursitti, our Director of State Government Affairs.
Thank you so much, Lauren, and thank you all so much for joining us today to have this conversation about advocacy on the federal and the state level that affects our autism community in North Carolina. We know many of you are probably very zoomed out. You might be dealing with trying to access online programming for your loved one with autism, or you're trying to work remotely. It's a very challenging time. So thanks for Zooming with us for just a few minutes today as we talk about what's going on in DC and in Raleigh. So we all know, as I mentioned, this is a challenging time. I have a 16-year-old son named Jack, and he has autism. He has a severe intellectual disability. And the changes that we've experienced over the last few months, it feels like we were already kind of climbing Mount Everest, and now the path is even steeper. And I'm sure many of you feel the same, and we've heard from you that you're feeling the same because of many things that are listed here. One, of course, is school being closed. You know, who planned for that? No one was prepared to provide remote education. Our families are just stretched, and it's been very hard. Day programming, that's so important for adults who are trying to be in the community, that's gone right now. Clinics have been closed. That shift to telehealth, it's been important, and I know there have been conversations ongoing about that. It's been helpful for some, easier to access healthcare that way. For others in our autism community, telehealth just doesn't work. You know, it's hard, and in person is so much more effective. So finding that balance and just transitioning to as the only option recently has been hard. Accessing mental health supports are so important. I actually talk to a counselor every week just to help me as an autism mom be the best that I can be. And people with autism deal with many things and need to have access to mental health supports, family members, siblings, those who provide care for them. We all need help. The lack of connection to community. I always give the example, and forgive me for sharing so much personal stuff, but my son Jack every week on Saturday about 3 o'clock asks for wings. And what that means, we all know, is that he wants to get in the car and drive to Outback Steakhouse, walk in the door and see the smiling faces, all who've known him for many, many, many years, and all who are very happy to provide him with his wings and his cranberry juice and all the things that he so looks forward to. And so over the past few months, we've not been able to do that. We have gone and picked up wings and brought them home, but it's not the same. Jack's people, he's not able to see them. And that is hard week after week. Disruption of employment in the community has been devastating. Respite is so important for families, and we've heard stories of families who are providing that 24/7 care, and they're just so stretched. We heard of a terrible story in Georgia recently where a young man wandered while his mom had just jumped in the shower quickly at 10 o'clock at night, and there was a really tragic outcome. So it's important that moms have time to shower and people with autism have time to get away from their families, and the families can have some respite. Disruption of routines, loss of income has been devastating. Our economy has been severely impacted by this pandemic. People are suffering and struggling and going on unemployment. And for families who have an autistic loved one, economically, many it's already challenging for. So this has made it even harder. And just to be candid, challenging behaviors, there's something that we don't always talk about. I think some people feel ashamed. We don't want to, attach stigma to an autism diagnosis. But we do know that our community and people with autism can struggle with challenging behaviors, especially during times of crisis. And so having the tools to be able to provide supports to help that person feel better and to keep everyone safe is so important. And a lot of times those challenging behaviors can turn into self-injurious behaviors. So it doesn't always go outward, it can go inward, and that is devastating and heartbreaking. So we're hearing a lot about that right now too. And then we're also hearing so many concerns about being able to visit loved ones in the hospital when they're accessing health care. If you're a person who has autism and you're hospitalized, you have COVID-19, can you have a caregiver with you? What does that look like just to help you through that time? And so that has been another issue that we've added to our list as we've heard story after story from family after family, from provider after provider. We hear these stories frequently through our autism response team. They have an 800 number that is provided all the time, 24/7, that you can call. If you're an emailer, you can just email help@autismspeaks.org. That same staff is monitoring the email. There is a number available for those who speak Spanish. And also, if you go to autismspeaks.org, just our website, there's a chat window if you prefer just to chat. But we are hearing those stories, and our autism response team is an amazing group of human beings that's there to provide information and help during this time that's really hard. They've been there pre-pandemic, but they're working very hard to be there for our community during such a time of crisis. Today, we're going to talk more about those community supports and services, which is at the end of the agenda. Janet Williams is going to talk about that. She does community outreach. Many of you probably have already met Janet. She's amazing. We already heard from Lauren and our local staff, and we're so appreciative of the work they've done in the Carolinas for all these years. First, we have Dave, who's going to speak to us about what's going on in DC. You've heard a lot about federal legislation. It seemed like for a few weeks there, it's just constantly passing. So Dave is going to explain to us what that means to the autism community specifically. And then Patrick Valentine and I are going to provide information to you about what's going on at the state capitol and in the various state agencies for our community. So hopefully you can grab a sandwich and sit back and just take in this information. If you do want to ask questions, as Lauren said earlier, everyone's muted, but we encourage you to please utilize that chat box. We're trying to keep the sound under control and make sure everyone has the resources that they need to see this webinar. So feel free to engage via the chat box, and we will stop from time to time to answer some questions. I don't know that we'll get to all of them. If we don't get to your question, you can email the Autism Response Team. We've been doing a fairly good job of getting them answered as we go. We do have Kelly Hedrick, who heads up our state government affairs and grassroots efforts, monitoring the chat box. She's a pro. And then also Emily Mulligan is here with our Autism Response Team. So lots of folks to help get information to you today. Okay, I have done enough talking. I'm going to turn it over to Dave now, and he can share with you about all the things that are going on in Washington, D.C. that affect our families. Dave, take it away, sir.
Thanks, Judith. Great to be with you all today. As Judith mentioned, my name is Dave Sidkowski. I am the Senior Director for Policy and Federal Government Affairs with Autism Speaks based in Washington, D.C. So today I wanted to go over what has happened in Washington since the COVID pandemic outbreak began in the United States, and talk about what we have been advocating for related to autism community priorities and where we see things going forward. This is just meant to, even though there's going to be a lot of information thrown at you in the next few minutes, is really just meant to be an overview. I'm not going to be able to get into every detail, and certainly if there are things that you've heard about or questions that you have related to things that have been happening in Washington, please don't hesitate to put in questions in the chat box, whether it's about something I didn't cover here or something I do go over. I'm happy to try to answer any questions that you might have. What I want to do is start back in early March. So after the pandemic really started to hit in the United States, Congress passed the Coronavirus Preparedness and Response Supplemental Appropriations Bill. That law really was the first amount of money that was provided through the federal government specifically for the public health response to COVID-19. And you'll notice that we have the different bills listed here as COVID-1, COVID-2, COVID-3. And really that's just to convey the order, the chronological order of when these different COVID-related response bills were passed. This is oftentimes they'll be referred to in this way in news articles, and so wanted to just include that for context here. So of course, the actions taken by Congress did not end with that first initial $8 billion that were provided for the public health response. In mid-March, on March 18th, the second bill, the Families First Coronavirus Response Act, passed. That included several important provisions, including a new emergency paid sick and family leave policy to allow individuals to access not just the existing FMLA and sick leave policies that exist, at least in terms of sick leave in terms of employers, but also providing this additional paid sick and family leave. And the Department of Labor has provided questions and answers regarding these provisions of the law, which we'd be happy to share with anybody who's interested. In general, this is available for certain employees at employers with 500 or less employees. So the second bill also contained other things like tax credits, free COVID-19 testing were available, an expansion of food assistance and unemployment benefits, and then an increase in Medicaid funding, which is important in terms of ensuring access to healthcare. Is a 6.2% increase in the federal matching percentage for Medicaid dollars, for Medicaid spending. on March 27th, Congress acted again in the Coronavirus Aid, Relief, and Economic Security Act. This is a law that I'm sure you've all heard about in one way or another. This was the $2 trillion relief package that was provided by Congress to address all different facets of the economy and to try to assist governments, local governments, individuals, and small businesses. So the economic impact payments, or that's how they're referred to as by the IRS, but also stimulus checks, the $1,200 that most Americans received in addition to the $500 for dependents under age 17, that was provided through this bill. The increase in unemployment benefits, so the $600 per week increase on top of existing unemployment benefits, was provided through this law. Hundreds of billions of dollars to address the public health response, whether this was funding to go to hospitals, healthcare providers, or to local, state and local governments to specifically respond to COVID-19. That was a part of this law. The Paycheck Protection Program, which was a forgivable loan program for small businesses and other employers to retain employees and keep their businesses operating during the COVID-19 pandemic, that was included in here. And then billions of dollars for education, both for higher education institutions as well as elementary and secondary education. Judith will speak about this later on in terms of the breakdown of funding going to North Carolina, as well as what we're doing in terms of our advocacy around this to ensure that it's being directed and helping the autism community. And then lastly, the law also extended the Money Follows the Person program through November. Go to the next slide, please. So from the time the March 27th law, the CARES bill, passed, there was a lot of discussion about the fact that there might be a need for more money going out to individuals and families, to small businesses, to the healthcare response, state and local governments. And so really since that bill became law, there has been ongoing discussion, maybe some negotiation around what an additional relief package might look like. Congress did pass another bill, however, on April 24th, the Paycheck Protection Program and Healthcare Enhancement Act passed. And you'll see here it's referred to as COVID 3.5. The reason it's referred to as that is because it was very narrow. It was just meant to replenish the funds for the Small Business Assistance Program, the Paycheck Protection Program, which ran out of funds really quickly. This was the Congress provided $350 billion in funding, and because of the really tremendous challenges being faced by small businesses, there was high demand and the money ran out quickly. So there's a desire to replenish that program and then through some additional negotiation provide some money for hospitals and for COVID-19 testing. So it really only covered those specific issues with the acknowledgement that anything outside of that scope would have to be dealt with later on. So if we could go to the next slide, please. Thank you. So throughout March and continuing on from there through this day today, we have been trying to listen to the concerns and hear what's been happening on a day-to-day basis within the autism community and try to take those concerns and then bring them to Washington, bring them to the state level and local level to try to see what we can do to help advocate for the community. And while we have a list of items here, we of course have looked at other issues as well, and welcome any comments or suggestions or things that that you've been experiencing that you think would be helpful for us to look at as well. So one of the major priorities we've been looking at is ensuring that there's additional funding for home and community-based services. This is to ensure a continuity in the workforce, hazard pay, to ensure that there's personal protective equipment made available. With the disruption in services that's occurred, this is more important than ever, and maybe even getting people off of wait lists. There are a variety of ways where this additional funding could really serve a critical need right now for the community. Additional funding to meet the educational needs of students with autism. This is looking at both ensuring that despite the distance learning situation that we find ourselves in right now, for the most part, that whatever can be done to provide technology or other services at this time to ensure that there's some level of education, or that there's some level of comprehensive education being provided to students with autism. We're pushing for that, as well as ensuring that when students return to school, that schools have the resources to be able to address the learning loss and regression that we know has occurred during this time. And so we're pushing on both ends. At the federal level, and then at the state level, Judith will talk about what our efforts have been as well, but it's been similar in some ways across what we're doing in our advocacy on both the state and federal levels. Protecting the rights of students under the Individuals with Disabilities Education Act. Throughout the month of March, there was a lot of concern that Congress would waive some of the core protections of IDEA, and we, along with many other organizations, thought that was the wrong direction, that the flexibilities exist under the law to be able to continue to provide services even from a distance learning perspective without waiving these core protections that have been so hard fought for so many years. And so what ended up happening is, in the March 27th bill, the CARES Act, there was a requirement that the Secretary of Education issue a report that would articulate any additional waivers that she thought would be necessary for IDEA. Fortunately, at the end of April, she released that report and did not recommend any waivers to IDEA. So, while we saw that to the core protections of IDEA, I should say, while we saw that as a positive, we know that there are significant needs that still need to be addressed, both in the short and the long term. And so we'll stay vigilant on efforts to erode the protections of IDEA. But at this point, it seems like that threat has subsided, and we have been continued to focus on other areas of education. Expanded access to telehealth services for healthcare needs. As Judith has mentioned, for some individuals, telehealth has been a really a significant benefit. For others, it is not ideal, and it's certainly not the same thing as meeting with your healthcare provider on a face-to-face basis. So what we've been advocating for is just to continue both during this pandemic time and afterwards, the things that are working for people on the autism spectrum, while at the same time recognizing that there are a large number of people where telehealth doesn't necessarily work the best, and then also in ensuring that we're continuing to educate physicians through a telementoring capacity on the healthcare needs, the specific healthcare needs of individuals on the autism spectrum, so they can do a better job in terms of their provision of healthcare. So the next item we have on here is related to the economic impact payments that I discussed earlier. So the CARES law provided $500 in economic impact payments for dependents under the age of 17. We heard from a lot of members of the autism community and others that, and also recognize that this is really inequitable and leaves out a lot of individuals and families within our community. We've joined with a number of other organizations in advocating that these payments be made retroactively to dependents over age 17. It would require a change in law. There are bills that have been introduced in both the House and Senate that we've joined in supporting. And we're hopeful in the future this is something that could be addressed and something we will continue to advocate on. According caregivers of adults with disabilities, the same emergency paid sick and family medical leave policies accorded to caregivers of children. So the emergency paid sick and family medical leave provisions that were passed as a part of the March 18th law allowed for eligibility for this for a number of different categories of individuals. So individuals who are directly impacted in terms of their own health care or family's health care or health related to COVID-19, several other categories, but one was if you are the caregiver of a child whose school is closed or daycare center has closed. But there was a lack of clarity around caregivers of adults with disabilities whose normal source of care or programming was no longer available. We commented to the Department of Labor, and others in the disability rights community also did. And fortunately, the Department of Labor made the right decision and provided that clarity to say that those caregivers of adults with disabilities would also be eligible. The next item is preventing discrimination in treatment decisions and care allocations based on disability. There's a lot of concern, especially with the peak of COVID cases that had occurred in terms of ensuring that treatment decisions within a situation where there was a lack of resources weren't being based upon somebody having a disability, and so we were advocating for equity, and we applauded the policy that was, or the guidance that was issued by the Office of Civil Rights through the Department of Health and Human Services that said to healthcare providers across the country that they shouldn't be discriminating based on disability. We've also been advocating for ensuring that personal protective equipment, PPE as it's known, is provided in group home settings, and have also put out a statement related to the issue of caregivers not being able to be with individuals with disabilities during the hospital stay. We've heard a lot of really tragic and terrible stories that have occurred in this space, and continue to advocate on that as well. We have been bringing these concerns to members of Congress on both sides of the aisle in both chambers. We're fortunate that the co-chairs of the Congressional Autism Caucus, who we work with closely on a number of different areas and have been doing so for many years, they've sent letters to congressional leadership advocating for many of the priorities that we've articulated here and continue to press forward. We remain in constant contact with them. On the most recent letter that was sent by the Congressional Autism Caucus, Congressman Butterfield from North Carolina joined on that, so we were really excited to have him as a part of that. And we're hopeful that members of Congress continuing to raise their voices and advocate on behalf of the community will help move a lot of these priorities forward. Go to the next slide, please. All right, so I know I've thrown a lot at you. I'm going to try to be quick with this last slide. So really, right now we're in a bit of a standstill in terms of the next round of relief. On May 15th, the House of Representatives passed the HEROES Act, which is a $3 trillion package. There's $1 trillion for state and local governments. There's money for housing. There's money. There's a fix to ensure that the Postal Service is intact. There's, just a whole host of different areas that are covered by this massive bill. This really was kind of the opening salvo in negotiations around the next relief package. So while the bill did pass in the House, there's been, the Senate Majority Leader Mitch McConnell has said that he is not taking up the bill in this form. And so there's going to have to be a lot of additional back and forth and negotiation before a final deal is reached. We did want to still point out some of the priorities of ours that were included in the HEROES Act. So there was a substantial increase provided for home and community-based services, both in terms of an overall Medicaid increase and then also specific funding for home and community-based services. $100 billion for education. It fixed the dependent over age 17 issue, so retroactively providing those payments. Clarified the paid sick and family leave issue that we just discussed, and provided for $10 million in developmental disability activities. We're going to continue to try to hear from you all, and in terms of any specific concerns or other concerns that you are experiencing, and continuing to, and we are going to continue to advocate at the federal level to fight on all these different priorities. So with that, I will turn it back over to Judith and Kelly to see if there's any questions.
This is Kelly. We had a question that was from an individual who has an adult with autism asking about potential benefit eligibility. I think that's something that has some individual circumstances. So the autism response team can help him to look into that. And so unless Dave or Judith has anything more that they want to add about the potential to have benefit for adult dependents or SNAP benefits in North Carolina, we'll let Art work with him on that.
Yeah, I think that sounds like a specific question we need to address, and we're happy to do that. So, okay, thank you, Kelly. All right, everyone, I don't know if you need to get up and stretch really quick if you're tired. Please, I can't see you, so go right ahead. All right, so we're going to talk a little bit about what's going on in Raleigh and across the state of North Carolina. Many of you may know we actually have been working in North Carolina for years. We have, from a state advocacy perspective, we spent many years working on getting insurance legislation passed for things like speech, OT, PT, and behavioral therapies like applied behavior analysis. And we still have efforts that are ongoing. We have a lobbyist that many of you have met in Raleigh before. His name's Patrick Valentine. And he's actually in a committee hearing right now. I've been texting back and forth with him. He was going to join us to provide real-time from Raleigh updates. So I'm going to just share with you what Patrick has shared with me. And then we're going to send this presentation out to you. We'll have a recording of it and then also a copy for you with links in it. So I'm going to update this slide before I send it to you to make sure you have all the information from Patrick. So the bill that we're working on, the specific bill, is a bill that's passed the House Bill 671. And what it does is allow board certified behavior analysts, the people they supervise, to provide applied behavior analysis. And that is standard practice, standard evidence-based practice nationwide. And North Carolina is really the only state that has excluded BCBAs in this way. And Autism Speaks doesn't represent providers, we represent families. And we want to make sure that our families actually can access the services that were mandated in the autism insurance law that was passed and you all worked so hard to pass. So that bill, fortunately, has already passed the House, and now we're trying to get it to the Senate. And Patrick's most recent report from Raleigh is that our bill has legs. You know, the legislative session is occurring right now, and it will probably go for a week or so. They're kind of in the end days, but we actually have momentum in the Senate, so we're feeling hopeful that we will be able to get this tweak passed. The law that was passed originally, the autism insurance law, was one that many people worked on, many organizations worked on. And it was a big step forward, but we just want to make sure that board certified behavior analysts are able to provide the services in a meaningful way to our families. That's what it's all about. It doesn't matter if we pass the law if it doesn't help our families. So that is pending. Stay tuned. And then also, too, just for your information, 15% of North Carolina has no access to Wi-Fi or broadband. And so we're advocating around that. And we're also advocating around $27 million for children with disabilities right now. And they're like individual budgets, not a big budget that's being passed right now. So please stay tuned, and we will be sending out advocacy alerts. I'll talk with you later about how to make sure you get those, but that is the latest from Patrick. We would share it in a much more exciting way, but I want to make sure you all know what's going on in Raleigh. And now we're going to kind of geek out for just a few minutes. I will try to be brief, but I want to make sure you're aware of agency action and changes that have occurred during the pandemic that could affect the way you receive services, and hopefully in a positive way. So with our state advocacy, we focused on three things: healthcare, which is so important, home and community-based services, those HCBS services, mainly that's through the Innovations Grant or Innovations Waiver in North Carolina, and then special education, early intervention. We're trying to look at all those buckets and see what we can do to advocate and take advantage of opportunities right now that are occurring federally and on the state level. So let's talk first just briefly about healthcare. For those of you who access your healthcare and it's covered through Medicaid, there are flexibilities around that that have been approved. And because it's Medicaid, it has to be approved by CMS federally. So there's this waiver called an 1135 emergency waiver that pretty much all the states have taken advantage of, including North Carolina. And so some of the things that have been approved, they were approved on March 23rd, were a modification of how providers enroll. There's opportunity for services to be provided in alternative settings. Screenings and reviews have been modified, as well as state hearing requests and appeal timelines. And the prior authorization requirements have been relaxed too. So the whole point of that is, if you have a child with autism and they're on Medicaid and you need to go to the pediatrician or access healthcare in that way, they're trying to make it easier. So if it needs to be done in an alternate setting, or if there's pre-authorization that needs to occur, that might not be the case because of this waiver. So if you're a Medicaid person, please know that. The other thing, we talked about this a little bit earlier too when we were talking about challenges, but accessing telehealth is definitely something that has been desired during this time of isolation and quarantine. So those of you who are on Medicaid for your health insurance, or you use it through the waiver, there are ways to access those services through Medicaid. The federal Medicaid agency came out early on during the pandemic and said to all the states, hey, we want to make sure that you're utilizing telehealth. And so that directive came from on high, and so states have implemented telehealth for Medicaid services. And I do have a link on this slide about how North Carolina Medicaid has done this, what it looks like. They have a ton of information on the website about how things are coded, how the system works. There's information for providers and for families. So if you really want to look at those details, I know some of you are just, oh, no thanks, and others of you definitely want to read all those details. They're available at the link, so please take advantage of that. People also actually are accessing telehealth who have private health insurance. So if you get your health insurance through your employer, what does that look like? And so there's not necessarily any sort of blanket order around this, but what is happening according to the North Carolina Department of Insurance is that the various health plans, Aetna, Blue Cross Blue Shield, Cigna, United, and First Carolina Care are all providing information about how they are providing telehealth. If you run into issues with this, we want to know. We want to advocate and make sure that telehealth is available. And we're thinking too about what this is going to look like long term for those who it's been beneficial, who can't access care because of where they live. Telehealth might be a good solution. What we don't want to do is dilute in-person service delivery if it's medically necessary. That's so important. Evidence-based practice, meaningful services for our families need to continue. And so another tool in the toolkit is great via telehealth, and we're all for that, but we don't want it to mean that services you should be receiving in person are ever diminished in any way. So we will keep everyone posted on that. And what does that mean for private health insurance, Medicaid? Telehealth can include behavioral health treatments, things like speech, occupational and physical therapies, psychological and psychiatric care. Different providers are doing things different ways. I think generally speaking, the number of hours that people are receiving in comparison to what they did in person are probably less, just because of the challenges of accessing them through a screen for someone who's on the autism spectrum. Not everyone, but it can be a struggle. But these are the treatments that are being utilized via telehealth. And I'll provide more information about that on the North Carolina website as well.
Judith, your audio is a little bit underwater sounding. I don't know if there's any adjustment you can make, but just wanted to let you know.
Thank you. Sorry about that. Is that better?
Yes, that's better.
Okay, I scooted in a little, so hopefully that'll help. Sorry about that. Hopefully the slides were informative enough. Okay, we'll keep rocking along, and please don't hesitate to let me know if it starts acting strangely again. It's funny, I'm talking about telehealth and access, and I'm having issues myself, so that's our life these days. Okay, so let's talk about waiver services. For those of you who utilize the innovations waiver, there are some modifications that have been made around that through something that's called Appendix K. And North Carolina was actually the first state in the country, I believe, to apply for Appendix K during this pandemic. Appendix K is something that's available for states when they're going through an emergency. So it's not new in and of itself, but when this pandemic occurred, I think North Carolina was one of the first states to apply. There are approvals based on services specific to our community in the innovations waiver. So for instance, cost limits can be increased, service hours, respite can be provided out of state in some situations. Settings where waiver services are provided can be changed just because of what's going on with the pandemic. Temporarily permanent payment for services rendered by family caregivers. And for some waivers, that's already available. For others, not so much, but there is an opportunity there if you can't access staff right now. Qualifications for providers have been modified a bit, trying to balance safety, but also trying to get people hired and providing support. So there are many other things, home delivered meals, and then retainer payments for those providers of waiver services so that they don't go under during this time. We need them to survive economically, so they're there to serve our families. So these are just some of the things that were included and approved for Appendix K for North Carolina. These are temporary revisions during the time of the pandemic, and we're monitoring those, and we'll keep you posted as things change. All right, so the other thing that we've been advocating around is special education. There is guidance that was recently updated, it's about a month ago, by the North Carolina State Board of Education. And the guidance, you know, it kind of says, well, we have to provide a free and appropriate public education and perhaps compensatory services, but they don't provide a lot of details on the State Board of Education website or the Exceptional Children website. Patrick and I did have a meeting with the governor's office about special education issues that we've identified, hearing from the community. And so I'll share a little bit about that. We had that meeting because we knew that, as Dave said, there was funding coming down from Washington, D.C. Through the CARES legislation, and it provided funding for education specifically. Unfortunately, it didn't single out special education, but it did provide education funding. So there was $378 million allocated to North Carolina for K through 12, and that was delivered to the different school districts through a formula. So that wasn't really anything we could influence that much, but we could, you know, ask that they make sure that the districts make sure that they're allocating some of those funds to special education after they were allocated via formula. There was $357 million allocated for post-secondary education, And then the governor actually received 95 million that's discretionary for education. So he can allocate that to special education if he so desires. So when we met with his office, we asked him to do that. And we asked him to specifically think about funding for those who are struggling to access their Wi-Fi or hardware or software or communication devices needed to receive remote education. We talked at length about kids that are in early intervention right now. If you go to the early intervention website, there's not a lot of information about COVID-19 and what's happening. And we're very worried about those kids that should be receiving early intervention services right now. And what particularly is happening to those who are turning 3 during this time and are supposed to then have a plan to go into special education. We are talking about what in the world is happening as schools have closed and families have had to shift to this remote learning model. For many, it has not worked at all. And for a subset of the population, there is fear about returning to a school building or any kind of in-person service delivery model, and we totally recognize that. But we also are hearing from families who are dealing with those challenging behaviors, the disruption of routines we mentioned earlier, and they're desperate for some in-person service delivery because moms and dads are not teachers or therapists, and many of them have jobs and multiple kids, and it's just a system that's collapsing, this remote delivery model. So there has to be a balance of safety, but also some sort of return to in-person education for those who need it as quickly as possible. So we're asking them to think about that and not kick the can down the road. You know, it could be a situation with the pandemic where you have closures and then opening, and then, you know, who knows if there's going to be another closure. So we'd like to see a system in place where students can receive services in person over the summer even, and it's not necessarily defined as ESY, but just those services that need to be provided right now to avoid learning loss or regression and to make up for the services that were missed from March moving forward to now. We need help. Our community needs help, not in a few months, but right away. So we let them know that they can figure it out. The districts can figure it out. And then finally, we talked about students who are transitioning out of special education, who are aging out, and what are they being provided? They're supposed to be provided a transition plan that helps them as they reach that birthday. And so we want to make sure they don't miss out on the services just because they age out during this time. All right, I know that was a lot. Thank you for your attention. Please do stay in touch with us. You can do so by visiting our website at autismspeaks.org/advocacy. We're also on Facebook. We're on Twitter and Instagram. You can follow us there, and you can also message us there. And if you want to email us, you can email us at advocacy@autismspeaks.org. You're going to receive an email from us today with this information that we provided today or tomorrow, very soon. So please do just stay in touch. If you go to autismspeaks.org/advocacy, if you scroll down to the bottom, there's a place where you can sign up for advocacy alerts too. And we promise not to spam you, but we do want to stay in touch so you can know when our bill's moving or when something's happening with the budget or things are going on federally. We want to continue to stay in touch with you. So with that, I will stop talking to see if we have any questions, and hopefully my sound improved. I apologize for that.
Judith, we answered one more virtually on the chat, and then we have a big thank you from Laura Milliken utilizing Bob's link.
Great. Yes. Hey, Laura. Thanks for joining us. Okay. All right. With that, now you get the good part. So I'm going to turn over to Janet Williams, who's going to talk about resources that Autism Speaks has available for you and your families during this really trying time. So Janet, please share. Unmuted. There we go.
Okay, thank you so much. I was muted. Thank you, Judith, for that wonderful information. Also, thanks to Lauren and the entire advocacy team, and David. You guys are just amazing. We appreciate you bringing all of this important information to our constituents and the families that we support and serve most. And, you know, I just want to say that as the outreach director, I support all of Mid-Atlantic and South Atlantic. So a lot of you on the call I may have met, you know, at some prior meetings that we've had, but just want you to know that we're here and we're here to support you and your families. And, you know, we know that since COVID-19, it hit our communities, it hit hard. I mean, really, really hard. We've had to make some adjustments in which none of us have, you know, ever experienced before in our lifetimes. And, you know, in response to this news and the spread of COVID-19 among our communities, our amazing advocacy team, as you just heard, they have advocated for us, for our families, you know, and urge lawmakers at every level possible, you know, to make immediate action and take action to protect each of our communities. And so if you were to visit autismspeaks.org, which is our website, when you get there, we have so many resources that we have developed and we continue to develop to help support our communities during this COVID-19 time. There's a yellow banner that you would see when you go to that home page. It kind of drops down. And if you click within that banner, it will actually take you to that page that will provide you with all of these resources that we have. So, you know, there are resources to talk about all of those disruptive routines that we've had and access to services, you know, and it can be very, very taxing. We know that it's taxing on, you know, a person without autism, but it's certainly for those who have an autism diagnosis, it can be very, very challenging for them and their families. You know, parents and caregivers, they've had to take on the roles of teachers, including myself. And I just keep saying, I'm not a teacher. I'm not a teacher. And I hope that something that I've provided for my son, who's on the spectrum, that, you know, it would be able to help him in some ways when school starts back, whenever that may be. But, you know, we've had to make adjustments with, you know, our service providers and therapists of not being able to attend regularly. And like they indicated, you know, prior, that the telehealth is working for some, but then for other families, they find that it's very, very challenging. And of course, you know, our adults with autism, they're cut off from those services, and a lot of them have faced loss of jobs. They've been reaching out to us for support, and we have been providing whatever support that we absolutely can. And so we just want to let you know that we're making resources, we're creating them, you know, based upon the needs of each and every community. You know, we don't always have all the answers, but I know that a lot of the information that we provide will be very, very helpful, you know, to you and your family, because we know that it's challenging and this is happening around the globe, and it has forced us to adapt as best as we can. So, you know, although we are faced with all of these radical shifts in our schedules and Zoom meetings and having to utilize all of these different modes of communication, you know, changes in demands and social distancing and wearing masks, all of that, it has imposed adversity in the form of challenges. And so we are here, we support you, you know, we care about you, and we want to continue to provide these types of resources. Next slide, please. Now, at this time, we are so graced to have our manager of our autism response team. Her name is Emily Mulligan, and she is just an amazing person. And so I've asked Emily, you know, to kind of share some information more about the autism response team. We are an extension, including myself, of our services and supports team. And I just want Emily to just share directly what, you know, resources are available, what the autism team is doing, maybe some trends. And if you have any questions as she began her conversation, please type them in the chat box. Thank you, Emily.
Thanks, Janet. So thank you, everybody, for joining today. And I just want to echo that the advocacy team has done such a great job during this whole time. You know, invaluable what the work that they're doing. So yeah, I'm the manager for our autism response team. We are a team of, currently a team of 11 across the country. So essentially what we do is we talk with families via phone, via email, We have a live chat through our website, and then we also, talk to people via Facebook and other social media. So really, however people try to reach out to us, we can help. And we're here just to help you figure out solutions and resources that are available to help with kind of whatever challenges you're facing. And I know that that's really shifted so much in the last few months. A lot of new challenges, a lot of behaviors that families may not have seen for a few years, and things are they're starting to struggle a little bit more. A lot of people struggling with anxiety and mental health issues. So we're really here. We want to help connect people with providers in their area, with resources that can help you, strategies and tools that can help you kind of on a day-to-day basis. And we really try to be as individualized as possible. That's kind of our number one goal is, taking whatever situation you're dealing with and trying to find the specific resources that can help you. So we're available 9 a.m. to 5 p.m. In all time zones. So we have people on the East Coast and the West Coast and in between. And so we try to be as available as possible. So yeah, we really do encourage you to just reach out if you have any question, if you're having any sort of challenge. We get sometimes families who are just need someone to vent to for a few minutes. They may just be really frustrated and need someone to talk to that really understands what they're dealing with. So we really do, we encourage you to reach out if there's anything we can help with. And we do have 3 dedicated Spanish-speaking associates, and a dedicated Spanish phone line as well. So we try to be available to as many people as we can. So really, if we can do anything to help, please don't hesitate to reach out.
Thank you so much. On the last slide, Judith. And so this information will be shared with you, but these are just some of the resources that we have available as well. There's some summer camp information for our families. Not all of the programs that are listed are, they support autism, people with autism, but there are a lot of them that do. So, and then we also have other resources, as I stated, as you get a copy of this presentation later, please check out the links that are there, check out the information on our website. And again, thank you all so much for all that you do in supporting your families, and we want to help you help your loved ones. So thank you again for joining us during this time. I know that we're at time, and I appreciate you being a part. Thank you.
All right, everyone. Thank you again for being with us today, and we will send out these resources via email. Please take good care and stay in touch as we continue to advocate for you and your families in DC and in Raleigh. We'll talk soon.